I want to talk to you today again a little bit more about the implementation by our state of the Healthcare Reform Act. And again, this is the act which provides that children will remain on their parents' insurance and can, if they need to, until age 26. It disallows insurance companies from rejecting you as a consumer because of a pre-existing medical condition. For seniors and others, it closes that donut of costs as far as prescription costs, and also requires the health insurance companies to be accountable to make sure that they really are providing health care and not spending a lot of money on non-health care related expenses. We've been talking about how Indiana will efficiently and effectively cover up to an additional 400,000 people in the state of Indiana. And remember that for the first 3 years of the program, the federal government will pay 100% of this expansion of health care in our state. And so we get focused in on the dollars that are put into the program, but one of the things I like to say we need to keep in mind, and I would ask us to keep in mind, is the human element involved in all this. Now, the fact that we will have 400,000 additional Hoosiers who will receive health care, who at this time do not receive health care, probably defer getting the proper care that they need until they're so sick that they go to the emergency room. The problem with that is that's the most expensive health care that you can get, and if they're unable to pay for it out of their pocket, as you might well imagine can be the case, then those costs are passed on to the rest of the consumers who are paying premiums. So once the Health Care Act is enacted, there'll not only be a savings, but they're going to be a unquantified health care benefit for so many people in the state of Indiana. So this is an important issue. It is literally a healthy issue that could impact the lives of so many Hoosiers. I think of people such as those who have kidney dialysis needs, and they're waiting for us to do the right thing on this health care to make sure that they have access to that health care and that they can live the lives that we think all Hoosiers in our state should be able to live, healthy lives. So again, State Senator Tim Lanane talking to you about this important issue, and we'll keep fighting for the rights of Hoosiers in our state to have meaningful participation in the Affordable Care Act, in the health care reforms.